Hi, I'm Dr. Kevin Huff. First, I'd like to thank you for taking a few minutes to watch this brief video. Second, I'd like to introduce you to a little bit about our practice and what I think might separate us from many of the good dentists that you may have experienced or hear about. Um, First of all, I am a general dentist, which means that I treat um, patients of all ages, from very young to very old. We like to stick with the recommendations of uh, the American Academy of Pediatric Dentistry and the ADA, as far as we like to see children as early as we can. Usually the early visits, if they're 3 or under, would be just kind of a introduce ourselves, introduce the patient to our practice, um, and then move forward as the patient is able to tolerate that and enjoy their dental visits. Our goal is to keep dentistry positive from a very early age. Secondly, our focus tends to be much more on the adult population of patients from a comprehensive perspective. What that means is that we look at the whole mouth and we look at the person associated with that mouth. So our diagnoses tend to be based in collaboration with our patients through a process that has become known as co-discovery. What that means is that during our new patient exam, we will take uh, and many photographs and appropriate x-rays and gather much information. A very comprehensive examination involving an evaluation of the joints, of the teeth, of the muscles, of the gums. We do an oral cancer screening very routinely in our practice. And then we'll take that information and often we'll set up another visit with our patients to review those findings with them and to go into what's called the co-discovery appointment. And what that does is that enables you as a patient to take a tour of your mouth and see what we see. And together we'll build a plan that is appropriate for you based on what your needs may be, but also what your wants and desires are. So our focus will be one of education and coaching rather than me telling you this is what you absolutely have to have. Unless, of course, sometimes with urgent needs, that I will tell you this is what is absolutely necessary. Um, we also offer for any new patient that is interested in coming to see us, we offer complimentary consultations. Now that is not an exam. What that is we meet together. I like to review your history with you and talk about what some of your concerns are so that we can address those right from the beginning before even making an examination appointment to see if it's a good fit, because dentistry is based on trust and collaboration between the patient and the dentist, and that's the way it should always be for the best outcome for everybody. Our goal is for dentistry to be an enjoyable experience. We also offer several different financing options. Um, we are not an insurance provider. Now, what that means is that we are typically out of network. However, we still process the insurance claims for our patients and try to help patients who have insurance get the most for their benefits. Let me just take a minute to just say that dental insurance is not in itself an insurance policy. It's not a guarantee of money for treatment because most plans cover typically between $1,000 and $1,500 a year. And that usually comes with many limits as far as what that money can be spent with. So what we like to do is encourage patients to look at dental insurance as assistance, but not as it's going to take care of all of your needs. And we work very hard to educate our patients on what the benefits that they may have available to them. But again, we're not a provider. We do process those claims for you, though. If you have any further questions, I would ask you to please give our office a call at 330-364-2011. I'd be happy to meet with you in person, as I said, at absolutely no charge for a consultation. We just meet and talk about some of your concerns that you may have. If you want to take the next step or an examination, please feel free to set up the appointment first. Let us talk and get to know each other, and then we'll set that up. If you have an emergency, please let us know when you call. If there is pain that needs urgent attention, we can also bring you in as a new patient through an emergency exam where we will just limit our focus to that. Some of the other benefits that you may want to ask us about when you enter, or we may discuss, is our new cone beam technology where we can take three-dimensional images of x-rays. We use low dosage x-rays for many of our imaging purposes as well. Modern technology is great. I mean, we have lasers, we have milled crowns and restorations that are possible to do in one day. There are a lot of opportunities that I'd love to have the opportunity to discuss with you in person. So again, please give us a call, 330-364-2011. Thank you for your time.